Hey friends, and welcome to the Average Gal's Guide to Anxiety. In today's video, we'll be talking about the basics of anxiety, what it looks like, what the symptoms are, and the different types of anxiety. Let's talk about the basics. So anxiety looks like nervousness, fear, or unease in high-pressure situations, such as job interviews, giving a big speech, recording for a YouTube channel. A base level of anxiety is considered normal for most people to have because most people are going to be a little uneasy in situations like that. Most people are not gripped by fear just leaving the house. Anxiety does become a disorder when the symptoms are consistent over a long period of time, about 6 months to a year, and the symptoms are debilitating to your normal function. Usually that means you have a hard time leaving the house and you're just gripped by fear all the time. Those most at risk for developing an anxiety disorder are people who have experienced a traumatic event, people with family history of mental health disorders, or people with thyroid problems and arrhythmia problems. Anxiety is one of the most common mental health disorders. About 275 million people worldwide, or about 4% of the total population, have been diagnosed with an anxiety disorder. There are several types of anxiety disorders. There's generalized anxiety, health anxiety, panic disorder. There are specific phobias like for blood, vomiting, spiders, etc. There's also agoraphobia and social anxiety and separation anxiety. Generalized anxiety disorder is usually characterized by an extreme worry for no apparent reason. You're restless, you have trouble sleeping, you have intrusive thoughts about potential events, things that might happen or might not happen, and the outcomes of those things. Panic disorder is characterized by feeling sudden panic. Your heart starts beating really fast. You might have chest pain. You can have a sense of impending doom, like something is coming. And you can also feel like you're struggling for air. Now, different phobias we can talk about on a different video, but there are specific phobias that can be debilitating. There's also agoraphobia, which is a social anxiety, and that's usually characterized by a fear of leaving the house, usually a fear of large spaces, open spaces, large crowds, feeling enclosed in certain spaces, things like that. Now, the physical symptoms of anxiety is cold or sweaty hands, your mouth feels dry, your heart beats fast. You can also feel some gastrointestinal issues like nausea or needing to use the bathroom. You can also feel numbness or tingling in your hands and feet. You'll feel a lot of muscle tension. Sometimes you can feel shortness of breath. This list isn't exhaustive, but it's definitely some of the main symptoms of anxiety. Some of the mental symptoms of anxiety are panic, fear, uneasiness. Sometimes you get nightmares. Depending on your situation, you might have flashbacks of traumatic events that have caused anxiety. You can also deal with uncontrollable or intrusive thoughts, basically just obsessive thoughts about things that scare you and they're hard to control. Some of the behavioral symptoms of anxiety are, again, restlessness, just the feeling that you can't calm down. Sometimes you'll see people who have anxiety walking around and constantly doing things, and that's usually their attempt to calm their mind and their body down and to stop some of the symptoms from happening. Ritualistic behaviors such as turning on and off lights or picking at your skin, chewing on your lip, things like that. It's also accompanied by having a hard time sleeping. Sometimes you have insomnia or have trouble staying asleep. And another behavioral symptom is staying home or avoiding certain places or situations that might give you anxiety, such as avoiding crowds or avoiding malls, churches, whatever you think might trigger your anxiety or panic. If you're experiencing any of these symptoms and you've been experiencing them for a while and they're not getting better, I highly recommend talking to your doctor. They can help you with referrals to a psychologist so you can get a diagnosis and a treatment plan. Everyone experiences anxiety in their own unique way, so your treatment plan for you should reflect that. Whether you need medication or counseling or both, make sure that you talk to your doctor and decide what's best for you. Thank you so much for watching this video, and I hope you like, subscribe, and comment down below. Thanks! Bye.